Good evening, everyone. Thanks for joining us. We'll get started in just a moment. We see lots of folks piling in, so thank you for spending part of your Wednesday evening with us. This is a informational meeting, COVID-19 updates, lots going on. Just wanted to do some housekeeping. We will be taking questions, your questions throughout the webinar, and you can enter those at any time. Just look for that Q&A icon at the bottom of your screen on the right. You can submit your questions. Just in case anyone is looking for... Oh, wait, hang on. Oh, never mind. Just in case anybody's looking for or needs closed captioning, we are broadcasting this webinar live on our YouTube channel. And I will drop that link in the chat in just a moment. And that will also be just in case we have a cap of 3,000 YouTube channel. Oops, that's me. And I will drop that link in the chat in just a moment. And that will also be just in case we have a cap of 3,000 YouTube channel. Oops, that's me. And I will drop that. Sorry about that, everybody. Streaming. I'm going to drop the link to our YouTube channel just in case you need closed captions. You should have seen that link pop up in your chat. Just click the link on the in the chat, and then just look for that closed caption icon on the bottom. It should be in the bottom right of your screen, and you will see closed captions auto-populate. And I think at this point, we're starting to level out, so I will hand it off to our Assistant Superintendent of Student Support Services, Mr. Ed D'Alazzo.
All right, thank you, Mr. Gannon, and thank you for all your technical support getting this webinar up and running. I really appreciate it. Good evening, everybody. My name is Ed D'Alazzo. I'm the Assistant Superintendent of Student Support Services, and I have the privilege of serving the district, supporting students on many different facets of our school district. The division or the department I want to talk about tonight has to do with our COVID response. And so we have a presentation for all of you that we want to get through, hopefully get through it somewhat quickly, and then give us the opportunity to answer some questions after the presentation. Before we start, I do want to take the time to introduce our panel. And I will just go ahead and name everybody as I see them on my screen. And we have our superintendent, Dr. David Hagelin. We have our Assistant Superintendent of Teaching and Learning, Dr. Janelle Woodward. Our Assistant Superintendent of Human Resources, Mr. Julio Hernandez. Our Assistant Superintendent of Business Services, Mr. Ahmed Sheikh Hulaslami. Our Director of Student Services, Ms. Leslie Heller. And then our district nurse, Ms. Bina Bendali. And then our two coordinators of the two coordinators for pandemic services who will be doing a lot of talking tonight and who are amazing people really leading this work since the start. And so we have Hannah Mestel, our coordinator 2, and then leading the work, the amazing Miss Kelly French, our coordinator 1, pandemic services. So I want to thank the families who've joined us tonight for participating and really listening to our presentation. We do have a lot of information coming your way. And as you know, if you've been watching the news, COVID continues to have a fairly profound impact on how we run our school district. And so our goal since the start of the pandemic has always been to keep your children safe and then also to keep your children in school should there be a positive case or if they're a close contact and so forth. So we've implemented many different programs and services in response to the COVID pandemic. and we'd like to take the opportunity tonight to review some updates. And so the CDC, the California Public Health Department, and the Alameda County Public Health Department, they bring forth to us information and updates. And so our job is to really digest that information as best as we can, as quickly as we can, and then package it in a way that makes sense for the PUSD community. And so we want to follow those rules, we want to follow the mandates, but we also want to really look at the local level, how we can provide these services to our students. And we're talking to families, so I'm saying students, but of course this is also presented to our staff. And our staff has been amazing. Our teachers, our principals, our classified staff, the management staff you see here on the screen, just has been an amazing partnership with all of the divisions and departments in the school district working on COVID response. Parents and students, you guys are a big part of this as well. So again, thank you for being here tonight. So with that said, in the agenda, and I know Kelly and Hannah will go through it here quickly, we want to go through the updates, the latest information, difference between quarantine isolation. We'll go over that a little bit. We also want to talk about what are some upcoming events that may be coming our way, and then our testing services. We want to review what those testing services are and how it will impact your students here in the next couple of weeks. Okay, so we have a lot of information, like I said, coming your way. So without further ado, I will now turn it over to Miss Kelly French to start the presentation.
All right. Hello, everybody. Welcome to the COVID-19 update for PUSD families. We had a similar update last night for our staff, and we are grateful for the opportunity to present this information to you tonight. We realize that it is confusing and complicated, and so we're hoping that this presentation will help clear up a lot of the confusion. So thank you for taking time out of your busy evenings to join us tonight. We really, really appreciate it. I just want to start out with gratitude. I want to thank my boss, Assistant Superintendent Ed Dialazzo, the entire leadership team, the district nurses, my colleague and partner in crime, Hannah Mistel, who you're about to see is just an amazing individual that we are so fortunate to have working in pandemic services. And then our entire team of people, and it is a big team, making sure that we take care of your students on our campuses. And I can tell you with confidence that I feel really good about what we are providing to PUSD students and staff. And without further ado, why don't we go ahead and start with the presentation. So next slide, Patrick. We're gonna, today our agenda is we're gonna talk about Omicron, and we're gonna talk about our health and safety protocols. We're going to talk about masking recommendations, and that's a really, really important piece to health and safety right now. We're going to talk about vaccines and boosters and our PUSD testing services. Next slide. Thank you. All right. At this point in time, I'm going to pass it over to Hannah Mistel to tell you kind of where we've been and where we are. And I don't know, she doesn't have a crystal ball. I don't know if she can tell you where we're going, but Hannah, take it away. Thank you.
Thanks very much, Kelly. So just to provide some context to why we're having some updates now to all of our COVID practices here in PUSD. And that is because, as I'm sure you're all aware, the Omicron variant arose in late November. It was identified in late November, actually Thanksgiving weekend in Southern Africa. But at that point, it had actually already been present in many countries around the world. And it spread pretty rapidly and began to surge in our region here in the Tri-Valley in late December. It's important to have context that Omicron is more infectious than previous variants, even if you are vaccinated. So vaccination still provides great protection against severe infection and disease and hospitalization and more severe outcomes, but the chance of infection is still much higher with Omicron than with previous variants. But that said, our unvaccinated are still the most at risk with this variant. Fortunately, early data do suggest that it is a milder variant and it's less likely to cause those severe outcomes. So we're really grateful for that. All that said, it provides context that Omicron is the reason that we are revising and updating some of our guidance. And it's why we are having this chance to come together tonight, talk about what's going on in our district, and answer questions. So we're going to go through a number of topics as Kelly described in our agenda, but please do add your questions to the Q&A as I go. And we'll try to get to as many of those questions as possible after we go through the presentation here. Next slide, please, Leslie. Okay, so just as a refresher, the symptoms of COVID-19 overall have not changed. And I do want to highlight a few that are we're seeing more and more commonly with Omicron than with previous variants. The number one symptom that we're hearing for Omicron is, I just had a scratchy throat. And then maybe more symptoms emerged after that, but sore throat or scratchy throat is one of the chief complaints, along with headache, cough, nausea, and fever. Part of this is because Omicron likes to collect in that part of the respiratory system before it goes into other parts of the body. So Omicron is very well developed to attach to those cells, and it's both good and bad. So these are the symptoms that we get, but it also means that it's not necessarily going into the lower respiratory system, which is better from an outcomes perspective. All of these symptoms still can happen, especially since when we're seeing symptoms, especially in vaccinated people, it's often the immune system saying, hey, I've got to fight an infection. I'm going to have some symptoms that tell me my body is working as it should. But please be aware for any of these as we're heading closer into the months where our trees start blooming again, and you're thinking, oh, I might have allergies. Think allergies, but also think I need to rule out COVID. And very importantly, if you are sick or if your children are sick, please stay home until you rule out COVID. Next slide, please. There are a couple of terms that I'm going to use, and I want to highlight that they are not interchangeable, although a lot of people do use them interchangeably. The first is isolation. And isolation is what we use for people who are sick, which is people who have symptoms, or people who have already tested positive for COVID-19. People are isolated or are on isolation so that we reduce the chance of spreading the virus to other people. On the other hand, quarantine is what applies to someone who has been exposed to COVID-19, but has not yet developed symptoms or tested positive. So if your child is exposed at school, they will be put on quarantine, but not in isolation. But if someone tests positive, they're not in quarantine, they are on isolation. So just so if you hear me go through those terms again, that's the context. Next slide, please. All right. If anyone at PUSD, student or staff, has symptoms of illness, we must rule out COVID-19 before they can return to school. So if you have not already tested positive, the protocol is to test as soon as you can after symptoms begin and isolate at home until you're cleared. So just because you get that first negative test, you're not clear to resume normal activities. In fact, 2 negative tests are required at least 2 to 3 days apart in order to return to school. And the reason that we're requiring more testing, what we call serial testing, is that Omicron takes more time to incubate in the nose, and all of the testing that we do in PUSD and most of the testing in California is a nasal swab. And those nasal swabs require Omicron to have more time to incubate in the nose in order to get enough virus there to recognize on a test. This testing change for symptomatic students is to reflect the changes we've seen with the virus. So please be aware that when your child has symptoms, they will need 2 supervised negative tests at least 2 to 3 days apart in order to return to school. Kelly's going to cover the PUSD testing center services at the end of this presentation, but you can also go to a healthcare office or another community testing center location. The only thing we can't use for returning a student to school after symptoms is at-home tests. However, an at-home positive test is plenty for saying that someone is positive and moving them into the positive case protocol. So if at any point your student has a positive test, they move into the COVID-19 positive case isolation protocol. All right, next slide, please. That protocol is a 10-day home isolation for students. Here are a few tips for isolation. So the person who tested positive should stay away from other people in their household, in their own space, preferably with their own bathroom and bedroom if possible. And if that's not possible, the COVID positive person should wear a high quality, well-fitting mask whenever they need to be in shared spaces of your home, regardless of whether other people are present. And that's because you can release viral particles into the air that can linger depending on the conditions in your home for minutes or hours. And you don't want to accidentally infect more people in your home than you otherwise you could avoid it. I really want to emphasize that it is possible to stop the chain of transmission in your home, even though Omicron is so much more infectious than previous variants. It is not inevitable. So isolating the positive person in your house really can reduce the risk of passing COVID-19 to others. While we say it's mild, in a medical sense, mild is not a pleasant place to be. So if you can avoid getting this variant, you should still make every effort to avoid getting it. All right, next slide, please. I just want to end this section with some reminders about our health and safety protocols. First and foremost, students who test positive on any kind of test must complete a 10-day isolation at home. And that 10 days is either from the date that symptoms began, if symptoms were present, or from the date of the first positive test, if the person is asymptomatic. Please, I cannot emphasize this enough. Do not send your student to school after receiving a positive test result before completing the 10-day isolation, because the presence of a COVID positive person on campus may require others to have to quarantine. Even if someone is late in their isolation period, if they're not cleared to return to campus, they have not completed their isolation, we will have to do an exposure notification, and others, depending on their situation, may have to quarantine as a result. So please keep your COVID positive students at home for the full isolation period. Next slide, please. All right, our best way to fight Omicron is vaccination, but vaccination takes time and needs some time for your body to build up immunity based on that vaccination. So our most immediate weapon against Omicron is masking. It is time to up your masking game. That means using high quality, well-fitted masks. And fortunately, in our community, surgical masks are plentiful and easily accessible to most families. And if you are not able to get surgical masks, your schools have them available for your children. We are going to watch a short video. It's 55 seconds long from the CDC about how to improve the fit of a surgical mask. And then we're going to come back and talk about some other masking requirements at PUSD. Oh, if the audio works. Pause for a second. All right. Well, at this time, we will hold on the video. And I know that a lot of principals have sent out this video to their school sites. I encourage you to watch this video, watch it yourselves, watch it with your children. It's a really simple way to knot and tuck your surgical mask to improve the fit. And that helps increase the protection that you get from that mask by reducing any gaps for of air flow around your nose and your cheeks. As a reminder, indoor at all PUSD sites, masks are required for all people. Outdoors at elementary schools and middle schools, masking is required. And at high school and our district office, the masking is strongly recommended outdoors. Remember, indoors everywhere, outdoors at our elementary schools and middle schools, and strongly recommended outdoors at our high schools.
And Hannah, I'm going to chime in there on that note, is that I am a parent of a high school student. And in terms of outdoor masking, she better have her mask on when she's outside right now, just as we get through this Omicron surge.
Yes, I will echo that as a parent of a high schooler in PUSD as well. She knows to keep her mask on outdoors as much as possible. And that means whenever you're not eating, your mask needs to be on outdoors. Okay. We are going to put a link in the chat to get the most out of masking. It'll probably happen when we move to the Q&A. This is a resource from the California Department of Public Health, and it talks about how to improve mask fit, as well as which masks are the most protective for you against COVID-19. Let's move to the next slide, please. Public health officer wants to talk to us some more. Okay, so in the earlier parts of the pandemic, masking was primarily about protecting others from someone who did not know that they had COVID-19. It was source control. So pretty much any type of face covering was going to do a reasonably good job at preventing someone who did not know they had COVID from spreading it to other people by putting respiratory droplets into the air. But at this time, because Omicron is so very infectious, it is a great time to upgrade your mask to provide the best protection for yourself against COVID-19. I'm just going to go quickly through the recommendations from most effective to least effective at preventing Omicron infection. N95 masks are also known as N95 respirators, and they are super effective, but not necessarily the most comfortable for all-day wear for our students. And they really need to be properly fitted to be as effective as they possibly can be. That is not normally what most people will wear them as. That being said, that is why the California Department of Public Health has the category of more effective masks, KF94, KN95, wearing 2 surgical masks together, and wearing a fitted surgical mask using a knot and tuck procedure, which is what I was trying to show in the video before, which we'll make sure you get a copy of. Those are all ways to improve the fit of a surgical mask. A surgical mask, it comes with pleats, so you are able to stretch it over your face so that it's covering both your nose and your chin. The more you can fit it so that it actually is lying flush against your face and there are fewer gaps, the better protection you're going to get from it. So if you're just wearing a surgical mask without improving the fit or without double masking, at least ensure that you're stretching the pleats below your chin and above your nose. The least effective option is a fabric mask. And please note that at no time are valved masks or gaiters permitted at PUSD, but fabric masks are comfortable for our children, so we recognize some of the children will continue to wear them. But please note that they are the least effective at preventing Omicron for that student who's wearing that mask. It's still a good source control. Next slide, please. This is just an illustration of how air can hold viral particles that will enter a mask through the nose and cheeks. And just to highlight, a well-fitted mask will not have any gaps between the face and the mask, especially at the nose or at the sides. You want to make sure that you have good fit on your mask so that you're forcing the air that you're breathing to actually flow through the mask as opposed to through the gaps on the side. I don't know if anybody is able to see Kelly on the live stream, but Kelly is demonstrating for me that it's nice tight fit against her cheeks, as well as around the bridge of her nose and around the sides and then under her chin. You want the filtration so that viral particles are actually going through the mask itself and getting trapped by the fibers of the mask. You can get good filtration by using the right materials and more layers. Okay, so that's masking. Time to up your masking game, Pleasanton. Next slide, please. All right, I'm going to hand it over to Kelly French to talk about the most effective tool in our arsenal for COVID protection.
All right, thanks, Hannah. I am actually live from the Pleasanton Senior Center right now because we just completed a vaccine clinic. We vaccinated today alone 300 Pfizer boosters, and we had about 55 to 11-year-olds who came through today, and then another 50 Moderna vaccines. So we are, the reason why is because the CDC recommends vaccines for all people age 5 and up. And the CDC also recommends booster shots for all people 12 and up. The 12-year-old eligibility, 12 to 15-year eligibility just happened last week. And so you're eligible for a booster 5 months after receiving your second dose of the Pfizer vaccine, 6 months after receiving your second dose of Moderna, or 2 months after Johnson & Johnson. Why should you get a primary vaccination series or a booster? It's one of the #1 ways you can keep yourself, your students safe. The primary vaccination series is not as effective at the prevention for Omicron infection as it was against prior variants. So that booster really increases vaccine effectiveness. Thank you. And I also, sorry, we're moving on to testing, but we do have vaccine clinics available. Today was the first of 4 clinics that we're doing over the next 5 weeks. If you go to the PUSD website and you go to the main homepage, the 3rd news item down is vaccinations and boosters. And if you click on that link, you'll see, and there's still appointments available right now for our upcoming clinics. We have one next week at Fairlands Elementary School. Thank you, Fairlands, for hosting us. And then 2 weeks after that, we'll be back at the Pleasanton Senior Center. And then another week after that, February 9th, we'll be back at Fairlands. So do please, if you're considering vaccination, which we hope you are, take advantage of these clinics that we're offering right now. And then moving on to PUSD testing services, we are super thrilled to have a testing center. So we set up a testing site on the back side of Hart Middle School. And I want to say right now, if you're going to come to the testing center, please do not go to the Hart Middle School office. They are getting a lot of people coming in and inquiring about the testing center, and it's been disruptive to their day. So we want to encourage people to go to the website, and all the information you need about where the testing center is, what the hours are, who can test, is all on our website. And so if you go onto the website, you'll see check the hours before you come. The hours change frequently only because we're ramping up and we're working out staffing. But I think that we are going to consistently be able to offer 6 hours of testing per day. Today was busy. You do expect to wait in line. It's drop-in. You don't have to make an appointment. At the testing site, we will test any student for any reason. Specifically, we want to see people who, and you'll be, if your student does have an exposure or they do have symptoms, we definitely want to test them. We are running a rapid antigen test on everyone who comes through the testing site. And then depending on circumstances, we may want to run a PCR test or a rapid PCR test. So, but rapid antigen testing has been a very useful tool for us. And we're happy to be able to offer that. And thank you to all of you who picked up your at-home test kits. We distributed 12,500 test kits prior to the start of school. And we had a significant number of, actually well over 50% of people who picked up test kits logged them into primary health, logged their results into primary health. And we know anecdotally that a lot more people did the testing, but maybe fell short on the logging of the results. But we really appreciate this community's response and diligence of picking those test kits up and testing. I think that we had a lot fewer kids on our campuses that were COVID positive because of that at-home test kit distribution. All right, Hannah, did I miss anything on testing?
Nope, you definitely covered it. And just a time check, we're at 7:30, which is a great time for us to move on to our Q&A. Right. Before we do, Mr. Dialazzo, would you like to wrap this part of the presentation?
Yes, thank you. And I wanted to welcome the people that were able to log on here. We're almost at about 1,900 attendees. So it's really an amazing turnout. So thank you all again for being here. This is the website. I just want to reiterate what was said here, that there's constant changes and possibility of schedule changes and new updates that can come at any time. So the thing I want to remind our community staff and our families is we just need to be prepared to pivot and modify and change our procedures at any time. And we know that that sometimes can lead to some confusion. Our goal is to not let it be as confusing as it could possibly be. We want it to be as simple and easy as possible. So thank you for your patience. And again, your partnership, we're all in this together. But that's always our goal, to make sure that we inform the community as best as we can and in a timely manner with the correct information. So I just wanted to say that you can get information on this website that's on the screen right now. You may want to take a picture of it, screenshot, but you can always log on to the pusd.net website and you can get the information here on this web page. Okay, with that said, we are now moving towards our question and answer section. And as Ms. Mestel said, we have about 25 minutes, which is a good amount of time. On the flip side, because we have almost 1,900 participants, we have a lot of questions. And so I'm going to go through the Q&A as best as I can. And we're obviously not going to get to all the questions tonight. There are some questions that are repeated, so I'm going to try to go through those questions as best as I can and not ask the same questions over more than once, hopefully. Okay, so if the panel is ready, I'm ready to go through the questions. I will go ahead and facilitate and read the questions. And panelists, please feel free to answer as you see fit. Okay, what if I don't feel comfortable sending my kids to school when in California is the state with the most COVID cases?
I'm happy to take that question. In Pleasanton, in addition to our in-person instruction, we have a program called the Pleasanton Virtual Academy. My office is next to the Pleasanton Virtual Academy, so I get to see all the exciting things that they're doing over there for people who choose that option. And so that is something, if you're not comfortable with in-person instruction, I would recommend that you look into the Pleasanton Virtual Academy. Mr. D'Alazzo, do you want to add anything to that?
Yeah, please contact your site administrator, your site counselor, a vice principal. They will have information regarding the Virtual Academy for parents who feel that they want to not send their child to their home school. That Virtual Academy option is available for the remainder of this year, at least. And so that is the option. Can you please confirm there are no plans to go full remote for everyone? Dr. Haglund, do you want to take that question? I see that question come up a few times.
Sure, it's actually multiple times in the Q&A, so we can knock out several of them. At this time, the state of California does not provide an opportunity to use remote instruction outside of the independent study model. And so we do have independent study model available for students and parents who elect to go that route, but we do not have the option to do remote learning.
Thank you, Dr. Haglund. That question is the next one too, Patrick. Let's skip that one. Does Pandemic Services offer rapid antigen and PCR testing? Hannah?
Yes, so the answer in short is yes. Pandemic Services primarily offers rapid antigen testing unless PCR is called for a specific reason. At this time, PCR test turnaround is as long as 4 days. So it's not a particularly useful tool in answering whether someone has COVID right now and needs to be isolated. So we are preferring to use rapid antigen unless we have specific reasons that a PCR is warranted. We do have access in very specific situations to rapid molecular tests, which are in between in sensitivity to PCR and rapid antigen. And the Pandemic Services staff will advise you if that is what is applicable to your student at the testing center.
Great, thank you, Hannah.
Can I add one thing, Mr. D'Alazzo, which
Absolutely.
is just, we run several surveillance testing programs. So all wind instrument musicians in Pleasanton, as well as indoor athletes and certain staff are required to take weekly tests. We typically do use PCRs for those weekly surveillance tests, and it has been a very successful surveillance testing program for us.
Great, thank you. Why is the district quarantined 10 days for a positive test when the CDC guideline is 5?
All right. So the CDC guideline is different than what the state of California is offering and what the county of Alameda. So we take guidance from the CDC, and then the state's public health departments then take that information and make guidelines for the rest of the state to follow. And then local health jurisdictions, in our case, the Alameda County Department of Public Health, make their guidance even more concrete from that. And then with us, we are now at the school district level. We are always able to be more conservative in our approach than any other level. The 10-day isolation after a positive test for students is what we have, what we are going with. It is not a departure from what we've been doing all year. And we, based on what the state of California has given us as guidance, we need to require additional testing after that point, which is not the best use of the resources at this time, nor is it actually working. We are piloting our staff to be able to test to come back after 5 days with no symptoms, as long as they test negative. This is not turning up a lot of negative tests. Most people are actually completing their full isolation. So the expectation is that your student will be out for that 10 days in an effort to keep our entire community as healthy as possible. Kelly, would you like to add anything, or Mr. D'Alazzo?
No, I just wanted to say thank you for differentiating between the procedures for staff versus procedures for students. That's where that confusion kind of lies. It is a nuance. And Hannah, thank you for saying that the opportunity is there for coming back for staff after 5 days with the test. But what we're finding is testing from day 6 to day 10 for our adults, it's not coming with any negatives. They're still testing as positive is what we're finding.
And I will
before you go on to the next question, I just want to make sure that people know that there's a problem with the district website right now. So if you're attempting to click on some of the links in the presentation, you're going to get an error message. So that's being worked on, and we apologize for that. But I just want you to know that that's not you. It's actually a hosting problem that we're trying to get resolved.
Thank you, Dr. Haglund.
And I will add in to what Hannah was saying about the, oh my gosh, I just lost my train of thought completely. What were we talking about?
Retesting after day 5.
It's been a long day. Retesting after day 5. Yes, retesting. So for students, we do not want you to retest. If your student tests positive for COVID, then they're going to do a 10-day isolation period. There's no reason to retest. We've had people coming to the testing center. They said, oh, I ran an at-home test and my student is positive. I want you to make sure. We will not retest you. If you get a positive at-home test, it's positive and you should isolate right away and don't come down to the testing center because we want to keep our staff healthy so they can continue to do this work. So please isolate and do not retest. When the 10-day isolation period is over, then your student may return to school.
If they are completely recovered. I can't emphasize this enough. If your student has symptoms and they are not recovered after 10 days, please reach out and work with your site administrators to get their independent study to keep them home. It is not the time for students who have symptoms to be on our campuses, even if they are at the end of their 10-day isolation.
So Hannah and Kelly, since we're answering these questions, there's a lot of details to it. When the students receive their letters, their positive letters or their symptoms letters, this information is included in those letters, correct?
Yes, thank you for raising that, Mr. D'Alazzo. So if your student tests positive and you report that to your school, which is the first step in having a positive case, you will receive an isolation instructions letter. That letter right now, because of the high demand, we're taking 24 to 48 hours to get that out to you. But since your student is out for 10 days, it should have, ample time to reach you. That letter will explain isolation instructions, information about requesting independent study contracts. The answer on that one is always just contact your school site administrator. And it will also explain the date that your student can come back to school. If your student has symptoms and you report those symptoms to school, you call the attendance line, you say, my student is not feeling well today, that letter will come generally within the same day. But since your student will need to test negative several times, you will also have time for that letter to catch up to you. But these letters come, they have information in an email as well as a PDF attachment. And they explain all the dates that you will need to know, as well as all the information about what testing is required and where.
Thank you. This is written somewhere for you to find should you have any questions. Okay, next question. For fully vaccinated, boosted, asymptomatic students who are exposed in class, it now asks that we test our kids once per week for 14 days. 2 questions. Can they use an at-home test and register onto primary health site? And number 2, can we follow CDC guidelines and test on day 5?
Yes, thank you for this question. The recommendation for fully vaccinated, boosted, and asymptomatic students is to test regularly. So that is, once or twice a week for the 14 days following exposure. This is actually in line with our federal and state recommendations, but as we all know, the communication has been pretty confusing about all of this. So we're trying to get it down to kind of brass tacks for everyone. This does not have to be supervised testing. So if you have access to at-home tests and wish to use them, as long as your student doesn't have symptoms, they may test at home. And you can register and upload those results to primary health if you can. Testing on day 5 is definitely one of the days that you can test. We just ask that you please continue to monitor your student and test after day 5. But if you're not reporting those test results, your student is still coming to school in this case of being fully vaccinated, boosted, and asymptomatic.
Thanks, Hannah. Next question. Can you share the percentage of students who provided the 2 test results as of Tuesday morning before the first day of school as per the school district requirement?
I mentioned this in the presentation that we had over 50% of the test kits distributed were logged into primary. Hannah, do you have a more accurate number? I know you've been crunching numbers today more than I have.
Yeah, it's just over 50%. And we're really pleased with that. As Kelly mentioned, we know anecdotally that many more were able to take the tests, but did not log them either because they ran into a technical challenge or because they just didn't take that extra step. I would like to clarify, it was a strong recommendation. It was not a requirement for returning to school.
Thank you. We're getting some thank yous here on the Q&A. So I just want to say thank you to the people writing that. We really appreciate it. Why are schools not sharing daily COVID cases number in the community notification email that is sent out when positive cases are reported to our homeschool? Instead, they're just informing parents that there were COVID cases on a particular day. Kelly.
Actually, I'm going to pass this one over to Hannah. I thought this was why haven't you told us the numbers yet? And so I'll hold off for that question, but Hannah, you can answer this one about multiple cases.
Yeah, absolutely. So we are following the guidelines from the Alameda County Department of Public Health. And what we need to do in that case is notify those who have been exposed and then let our entire community know that there has been a COVID case on campus. We are not at this point releasing those numbers on a daily basis, partly because the data changes pretty frequently. We might have someone who was on campus on Monday, and then they went home with symptoms, and then we notify that there were cases on Monday, and then we find out on Wednesday or Thursday or Friday that person eventually tested positive. We're not going to go back and say on Monday, oh, by the way, on Monday there was another case here. So it's a little bit nuanced. Right now, given the level of COVID activity in our community, though, everyone should be taking as many precautions as they can and consider yourself at risk of being exposed to COVID pretty regularly. That is just the reality in our community at this time.
Next question. How many students have been out this week? I could take this question. Well, I don't have the breakdown of the number of students out for COVID unless Kelly and Hannah do, but I can tell you that our attendance rate for the entire school district is holding at around 87% attendance rate. That means we have about 14,000 students in the school district, and about 87% this week have been attending. In comparison, typically we're at about a 97% attendance rate, which is a really good attendance rate. So hopefully we can get back to that rate here in the near future. But for this week, taking that attendance, it's about 87%, about 85% at elementary, 90% at middle schools. Keep that going, middle school students. And then the high schools are about 88% attendance rate. So did you guys have anything specific, Kelly, Hannah, for the COVID absences?
I do. I actually have some very specific numbers that I'd like to share. But before I do that, I want to give an explanation of why they haven't been shared yet. And when I talk about these numbers, I'm going to add them into the chat right now because they're no secret. The reason they haven't been shared is because we're absolutely inundated and I haven't had time to update the dashboard. That's one piece of it. Like, it's just, this job is huge and we're trying to get through and do all of this work. And one of the things that's fallen by the wayside is updating the dashboard. So we do, for those of you that don't know, if you go to the COVID-19 webpage that was shared in the presentation, which is currently not up and running because we're having a problem with the website, but it will be back up and running shortly. You go to COVID-19 webpage, and on the right-hand side, there's a little box that says PUSD. It's titled PUSD-COVID-19 dashboard. And I am the one who updates those numbers on a weekly basis. I usually update them on Saturday because we tracked since July 1st. We've been posting our positive COVID case numbers, and we track Saturday to Friday. So that's each week, Saturday to Friday. So that's what you see. And I also give a breakdown of elementary, middle, and high school, and then break it down for, students and staff. So how many elementary students, how many staff, how many middle school students, how many middle school staff, and so on, high school students, high school staff. So up until Christmas, the week of December 18th through 24th, the dashboard was updated. And so if you go to the dashboard right now, that you'll see that as of December 24th, we had 56 positive cases and we had 262 student cases. So that is July 1st, 2021 through December 24th, 2021. And that's the most recent information that you can get on the website. However, hot off the press right now, and because you're joining, you're getting this information first. I can tell you that as of yesterday at 1 p.m., and I can't give you a number right now because that, like Hannah was saying, the numbers are changing quickly. It's fluid. And so as soon as I report it out, it changes again. And I've been intentionally holding off on reporting December 25th through now because reporting was spotty during winter break, right? So a lot of people didn't report cases. And then the week of January 1st through 7th, we were getting flooded with reports of cases of people who had tested 10 days before. Now they were telling us. So if I had reported out the numbers from December 25th to the 31st, they would have been really low because we didn't have those reports, but now we do. So that's why there's this delay in the reporting, is because I wanted all the reporting to stabilize so that when I do report out the numbers, they're accurate. So I can tell you, and I like I said, you don't have to write these down because I'm going to put them in the chat and then you can screenshot it or whatever. But it's on December 25th through 31st, and I'm sure this is an underreported number, but we had 139 positive cases reported between students and staff. January 1st through 7th, okay, so this is New Year's. This is after we've all been doing our socializing, okay. 483 cases were reported between the week of January 1st and the 7th. So that was before we were school resumed. Now, Saturday, January 8th through today. So this is the last 4 days.
Through yesterday.
Through yesterday is 300 and no, I just took it. It's through today. Sorry, Hannah, I took it right before we jumped on this call. So it's through today, we have 358 cases. Does that sound right, Hannah? It includes today, so long as that got updated. So, like I said, I'll put these cases, I'll put these numbers in the chat so you can see them. Because of the number of cases, I haven't had time to do the breakdown of elementary, middle, and high school. And because I can't do that breakdown, it's just a system limitation, really. I can't report out unless I have that breakdown. And we haven't had enough time passed for the reporting to stabilize. And so as soon as the reporting stabilizes, I get these numbers. We'll crunch out elementary, middle, high school, and we'll report everything that I just shared to you through the dashboard. So just wanted to share with you that, there's no secrecy to the numbers or anything. It just is operationally challenging to put them out right now. So, but happy to share that. So, overall, when you add those numbers up, we're, as of yesterday at 1 p.m., we went from, on December 24th, 262 student cases to 1,059. So it is, as you all know, because you're all touched by it right now, a very, very large jump. But like Mr. D'Alazzo pointed out, our attendance is good. So if we have 14,000 students and, say we have 800 students out, that's still well over 13,000 students that need to be in school who are getting an education this week. In-person instruction, which is exactly where they need to be. So thank you for letting me have a long-winded answer there, but I really wanted to share some accurate information. And like I said, I will throw this in the chat for you guys.
Yeah, thanks, Ms. French. You're always so thorough. Really appreciate that explanation. So just a time check. It is 7:53. We have 7 minutes. We have 431 questions. So I think we'll get through them. No, we're not. So what we'll do is after this this webinar, we will download the questions. We'll review all of the questions, and then we will try to. It'll help tailor our upcoming FAQs, what we put on our website. It really helps us develop some future planning and also some information that we could put forth in some other venue. So your questions will not be lost. Trust me, we will go through them. Kelly?
And Mr. D'Alazzo, yeah, can I just add in that the COVID test DO at PleasantonUSD, not at PleasantonUSD.net email address. That's our central email address where people send us questions, they send us results. That's where a lot of communication around COVID happens. And I just wanted to point out that our COVID test DO inbox kind of looks like this chat box, right? The Q&A box, so I say that because I ask for your patience. We have every intention of responding to every single email that we get. But if you don't get an answer, at your school site, you have a trained COVID-19 liaison. You have a pandemic tech from my team. And so reach out to your school sites because it's not that we're not seeing your emails and we don't want to respond. We absolutely do. We just have a little bit of bandwidth issue of trying to get through all of them. And then I was hoping, Hannah, maybe I saw a question I was scanning and I saw one about the difference between an antigen test and a PCR. I was hoping maybe you could answer that very quickly. And then also, there's a myth, I think it's a myth, that the PCR is the best test and that a rapid antigen, that might be a false positive. So I should get a PCR to confirm. And it is a myth. If you get a positive rapid antigen, you should have confidence in that test. And there's sometimes a reason why you shouldn't do a PCR, especially if you've tested for COVID in the past, because those can show up positive for up to 90 days. So Hannah, can you give a little bit more detail on that?
You're on mute, Hannah.
She knows.
Oh.
So, all right, I'll try and fill in a little bit here, but a rapid antigen test is going to detect a high viral load. So that is a test that is going to pick up COVID-19 when people are most contagious. That is why it is a very useful test for us. PCR test is more sensitive, so it might pick up a lower viral load. So it's going to pick up maybe when people first get infected with the virus. And then because of viral shedding, you could still have PCR tests show up positive for quite some time after active infection is complete. So I just wanted to share that because I think, like I said, I feel like there's everyone just thinks PCR is where it's all at. They are both very, very useful tools. And like Hannah said, our team, when you come to the testing center, we will make a recommendation on which type, and sometimes both tests. Sometimes we want to run both tests. So I do appreciate whoever put that question in the chat, and we'll move on to the next one. Sorry, Hannah, I don't know what's happened to you.
Yeah, so again, we have a few more minutes here. There is a question about independent study, and I do want to ask it, and maybe Leslie, you can help with this. So my son is attempting to stay current as a possible with the high school work. I don't want to further burden teachers with independent study contracts unless this will disadvantage my son in some way. Can you clarify any disadvantage to skipping the formality of independent study and staying current through direct communications with his teachers?
Thank you, Mr. Dialazzo. So again, our primary concern is making sure students are staying up with their coursework when they are out on isolation or quarantine. The short-term independent study contract that is offered does allow the Pleasanton Unified School District to recoup some of the ADA when a student is not, we call it in their seat. So we only collect ADA when a student is in school. This a short-term independent study contract is a way for us to regain some of the lost revenue when a student is not in school. But a student is not required to do a short-term independent study contract. A family does have to opt in to that contract, and a student would not be penalized in any way for not participating in a short-term independent study contract. So as long as the student is keeping up on their work, there should not be any penalty to just reaching out to a teacher and making sure the work is completed.
Great, thank you. Director Heller, appreciate that. There's a question here about N95 masks. Maybe I'll turn this over to Mr. Sheikh Islami. The mask recommendations indicate using N95s or KN95 masks as more effective. They're becoming more expensive and not readily available. Is there a plan for PUSD to provide them to students to keep them safe?
Great question. We currently are looking at getting a large shipment from the state on either the N95 or the KN95. And so once we receive those shipments, we will make those available to students and staff. That is the goal of the state. We have some stockpiles of masks that have been made available to each of the school sites. But those are mainly for, as needed basis, and particularly our staff. Again, we have limited quantities of the N95, but we do have large stockpiles of the surgical masks, and those have been made available to the school sites to provide to staff and students as needed. Again, once we do receive the large shipment of either the KN95 or the N95 from the state, we will ship those out to students and staff.
Great. It is 8 o'clock. I'm going to ask one more question. It has to do with COVID test kits. I think that's an important one. It's come through a few here on the Q&A. Before I ask the question, again, 477 questions here. So we will print this out. We will go through the questions. And again, it'll help guide our work moving forward. So here's the last question that we'll take tonight. Can you please send home more COVID tests? The lines are way too long and it's very difficult to find them at any of our stores. We essentially paid for them with our tax dollars. Please hand them out as requested. Is there any new information, Kelly, regarding test kits, at-home test kits?
So the at-home test kits are not as plentiful in the state of California as the professional kits are. So we do not have a supply issue with the professional kits. Those are the kits that we are using at the testing center. And as I mentioned, anyone can drop into the testing center. We recognize it's a long wait. We're proud that our wait is an hour, because right now in other communities, it's 3 to 4 hours. So it is what it is. We don't really have the capacity to ramp up any more than we already have. It's just part of life during the Omicron surge right now. So we ask you to bring your patients. When this last at-home test kit distribution from the state, we got about 14,000 kits, right? One per student and staff member in the district. That's a 1 week supply. So if you think about the scale of that, if we tried to offer that every week, it's just that the supply is not there at the state level. So as much as we would like to do that, it's just not going to happen. If it does, if the state starts shipping us 15,000 kits a week, we will get them in your hands. We would love to be able to do that. Along the same lines, I saw a question in the chat about, if you can't use an at-home test kit to be cleared, what was the point? And this isn't verbatim of the question, but what was the point of sending at-home test kits home if it doesn't clear a student? It doesn't clear a student if they're symptomatic or if they are on modified quarantine because they've had because they're unvaccinated and they're unmasked. And so that has to be a supervised test. And that's what we're offering at the testing center. But for the at-home test kit distribution, we were testing people who wouldn't have tested otherwise. And we found a lot of positive cases. And like we said, if you test with an at-home test kit and you're positive, you're positive. So it is a useful tool, and we wish we could give everyone at-home test kits every week, but we just don't have the supply to do that at this time. Mr. D'Alazzo, would you be, I also have just a couple more things, and I know that we need to end this call, but public service announcement here. Follow the directions in your test kit. If you do have an at-home test kit and it says to do a nasal swab, do a nasal swab. I don't know how many of you are on social media out there, but I saw out on social media, people were saying, don't follow the directions, use that for a throat swab. Please don't do that. Please follow the directions in your test kit. And if it's a nasal swab, do a nasal swab. In terms of the other question is coming up with students getting vaccinated, our 5 to 11-year-olds, and people getting boosted. Previously, sometimes people have a symptom or reaction to the booster. They might end up with a fever or a headache. And previously, there was a chart that if you had mild symptoms after your vaccine or your booster, you wouldn't have to follow the symptom protocol. You basically get a little pass where you're like, no, you're okay. You just got your booster. You can go to school. But the Omicron variant really does cause a lot of mild illness for people, and it's so subtle, and our cases are so widespread right now that if you got your booster and you end up symptomatic, you do need to follow the symptomatic protocol of 2 serial tests before you return, and those tests need to be at least 48 hours apart. So that is a modification from what we were doing before. And it is, again, reflects what's going on in our community in terms of the widespread COVID-19. There was also a question about siblings. What do I do if one's quarantined and the other one? Household exposures are extremely complicated. And that's why we have pandemic techs to take your phone calls, to walk you through them. And it is not something that I want to try and cover in this call because they are all very unique and they require some one-on-one attention. So if you have those types of questions, please reach out to your site liaison. And Hannah wants to add 2 cents. I think she can talk to us again.
Yeah, I can talk to you through another device. Hopefully you can hear me now. Yes,
Yeah,
awesome.
go ahead.
My computer clearly knows that it's 2022. and it has Omicron or something. So I do want to reinforce, though, if your child has gotten an exposure notification and they're in some sort of quarantine, or they've been alerted that they have been a close contact or otherwise been exposed, in that situation, just know that the other children in your home are not in the same camp unless your child tests positive. So if you have a first grader and a third grader and you just got an exposure notice for your first grader, nothing changes for your third grader unless anybody gets sick in your house. Okay.
Good clarification, Hannah. Thank you so much for that. I appreciate it. We need to
All
wrap
right.
it up, right?
Yeah, we're going to wrap it up. I know Kelly's scanning the questions and really chomping at the bit to answer more questions, but out of respect for everybody's time, we are going to end it. Just again, to reiterate, there are COVID liaisons at each one of our school sites. So please talk to your administrator, ask who that person is. A lot of your questions can be answered by that person. We also have our webpage that we pointed out earlier this evening. So please look at that webpage for any data, FAQs, information, and so forth. And then the COVID exposure letters, the positive case letters, we'll have information in those letters as well, hopefully to answer some of your questions. We have about 500 questions that we will now make sure to go through. Some of them are comments and some very nice comments. So we want to thank the community for their support of what we're trying to do here. I said it earlier, I'll say it again. Our goal is to keep your students safe and to keep them at school even through this pandemic. And you have the right people doing the work, and you can hear from Miss Mistel and Miss French just how well informed they are. These are really amazing people who are doing amazing work for our kids and for our staff and for our community. So I just really want to thank them again for the work that they're doing tonight. Kelly, you had your hand raised before we close out.
I had my hand raised because we have a captive audience. If you have a student who is a wind instrument musician or an athlete who is in a group where we have been doing the surveillance testing, which is mandated by the state, we will continue that next week. And for those of you that are in the amateur group, and so we test on Mondays, and we have a holiday on Monday, we will be coming out with further instructions, what we'll be doing with the amateur group. But everyone else in secondary who falls into one of those camps, please be prepared to have your student resume surveillance testing next week. I thank you for your time. And like I said, we're going to get through this. And thanks for all your support out there.
So I want to thank the executive cabinet, Dr. Haglin, our district nurse, Bina Bindali, and of course, Patrick Gannon, our public information officer. Always appreciate him. Ms. Heller as well with student services. Thank you everybody for your attendance tonight and your attention. Please look out for any updates that'll be coming up, but probably soon. So we will always try to update you as best as we can. Okay, good night everybody. Thank you again for your participation. Bye-bye.